And now I have a new handout. I think it's my longest of the semester, and it has a kind of historical significance for me, that this is the year in which I retire. I will be retired and become a professor emeritus at the end of the academic year, officially June 30th, July 1st. I've been teaching this course for 40 years that I've been at Rochester. It's undergone many changes over that 40-year period, but it's essentially the same course. And this is the very last time I'll be teaching that course. We're hoping to recruit someone. We have a search process underway who will be able to take over this course and other policy-related courses. And our search process is going very well. We have a meeting with the search committee tomorrow, and things are looking pretty good, but no guarantees, of course. In any case, this is my last PH116 handout ever. It's a 20-sider. Thought it ends with a bang. Are there any questions or issues while those are going around? I'll be using that in the later part of today's lecture. Oh, one more. I'm sorry, two more. Okay. These are handouts prepared by Alina, who is actively involved in an organization based in the medical school called SNAP, which stands for Students for National Health Program. It's affiliated with the PNHP, Physicians for National Health Program. They are all the same, though they are different colors. Just thought variation would be nice. And you get a sense of what SNAP is about. Later today, I'll be asking Alina to make some comments specifically about what SNAP's activities have been in supporting a measure that's winding its way through the New York State political process, and other things that she'd like to comment on. Last thing, this is an on-paper course evaluation, supposedly just for TAs, but I think you should include me as well, because I understand that those of you who've already tried to fill out the online course evaluation, which I hope you all do, or you will fill that out, that there doesn't seem to be a way to indicate me as a TA, even though I am in effect a TA, a group leader. Let's call it group leaders. So if you tried that and were frustrated and wanted to comment on my role as leader of one of the Friday groups and couldn't, here's your big chance on paper. So these are TA evaluations, and there's a place to write in the name of your group leader. So if your group leader is Catherine, you write her name. I'm your group leader, you write my name, etc. I need a volunteer who will be willing to collect these at the end of the class. I'll stop 5 minutes before our final time, which would be 10 minutes through 10. So we'll stop at 9:45 and give you 5 minutes to fill this out. It won't take that long, but you'll have up to 5 if you want to ponder over the questions. And then I'd like the volunteer to collect them, put them back in this envelope, and return them as indicated in the label in the upper left corner to Jackie, that's Jackie Rizzo, in the History Department office, Rush Reese 364. We'll have a volunteer who is willing to hand these out at about 1:15 and collect them after people fill them out. You can fill them out in either pen or pencil. We'll have a volunteer. Okay.
Is there a time limit when you take it to the office?
No, but it shouldn't be too long. Don't wait. If you're weak, you'll forget about it. And I've known people who have taken them with them, put them in their room, and then when they were packing 6 months later to go home for the summer, they discovered the evaluations. So if you promise to do it within, let's say, 24 hours,
All right.
okay, you're our man. Any other questions or issues about anything to do with the course, the review session, the final exam, etc.? Okay, well, let's get started. We have a lot of different things to cover, and I'd like to hit some high points. So first I'd like to talk about the Affordable Care Act, and my view is that there's a lot of loose some uninformed talk about it from all sides of the political spectrum. I think, as you will see in the handout, that Republican talk and Republican behavior about it, President's talk and President's behavior about it, is particularly uninformed, but there's lack of information on all sides. So I thought it was one of the best ways to get a look at pros and cons, strengths and weaknesses, complexities of the Affordable Care Act is to go to someone who should be a pretty good authority on that, namely Barack Obama. Barack Obama, JD, law degree, Harvard, president of Harvard Law Review, professor of constitutional law at, I think, the University of Chicago or some other university in Chicago. Not a dummy by any means. And this is an article he didn't write all by himself, of course. He had staff, he acknowledged his staff, they collected data, but it's a very nice look back from his perspective on United States health reform, progress to date, and next steps. And it was published in JAMA, the Journal of the American Medical Association, on the issue of July, what's the date of this? July 11th, 2016. So you can read this simply. It's on Blackboard. And let me just highlight now a few key points. There are many. It's very nicely and competently and subtly written article. On page, I guess this is the electronic version, so the page number is E2. It might be different. I think this is the version that's on Blackboard. Anyway, he begins on page E2, left-hand column, with a review of why he pushed health reform so strenuously. So there's a little section called Impetus to Health Reform. In my first days in office, Barack Obama writes, I confronted an array of immediate challenges associated with a Great Recession. It's true, he inherited an awful financial situation. I also had to deal with one of the nation's most intractable and long-standing problems, a healthcare system that fell far short of its potential. In 2008, the United States devoted 16% of its economy to healthcare. And then the rehearsal of, we're paying so much, but we're getting so little by comparison to other countries. Here are some of the deficits and deficiencies. The U.S. health system, still left column, page E2, left more than 1 in 7 Americans without health insurance coverage in 2008. Everything is referenced, it goes to reference 7. Despite successful efforts in the 1980s and 90s to expand coverage for specific populations like children, that was S-chip, the United States had not seen a large, sustained reduction in the uninsured rate since Medicaid and Medicare came in the 1960s, and there's a chart graph that goes with that. I decided, right-hand column, says Barack Obama, to prioritize comprehensive health reform, not only because of the gravity of these challenges, but also because of the possibility for progress. Massachusetts had recently implemented bipartisan legislation to expand health insurance coverage to all its residents. Leaders in Congress had recognized that expanding coverage, reducing the level of growth reducing the level of growth of healthcare costs and improving quality was an urgent national priority. At the same time, a broad array of healthcare organizations and professionals, business leaders, consumer groups, and others agreed that the time had come to press forward with reform. References to that. Those elements contributed to my decision, along with my deeply held belief that healthcare is not a privilege for a few, but a right for all. So it was time. Now, President Obama says healthcare is a right for all. That's not what our Constitution says or what the Supreme Court has acknowledged, but at least he strongly believed it, and now tells us that it was a large part of his motivation. He felt that very strongly when he was in Chicago, in the Illinois legislature, and was there quite friendly with Quentin Young, spiritual leader, the intellectual leader of Physicians for a National Health Program, whose practice was in Hyde Park, Chicago, and had been head of Department of Medicine at Cook County Hospital, one of the largest urban hospitals for the poor in the country. And so he held on to that commitment, though by talking about the Massachusetts plan, he signals immediately that he had drifted away from the single-payer commitment that he had been explicit about, of which there is written documentary records, photographic evidence, and so on, that he was committed to it, but he thought it was feasible politically, and really followed the lead of the HCCU, the Healthcare Coalition for the Uninsured, focusing on filling gaps in coverage and trying to involve as many of the key stakeholders and players in the system as possible. And so a long, protracted set of negotiations began to craft something that bore a striking resemblance in general features to the Massachusetts plan. So he acknowledges that lineage of the HCCU coalition to first field test, call it that if you want, to national testing in the form of the Affordable Care Act. And all that's laid out. Let me just skip ahead. And this is very clear, good presentation, lots of graphs, very clearly laid out. And this is some of what he says in looking back. I am proud, says Barack Obama, of the policy changes in the ACA and the progress that has been made toward a more affordable, high quality, and accessible healthcare system. Despite this progress, though, too many Americans still strain to pay for the physician visits and prescriptions, cover their basic deductibles, or pay their monthly insurance bills, or struggle to navigate a complex, sometimes bewildering system and remain uninsured. More work to reform the healthcare system is necessary, and I offer some suggestions below for how the Affordable Care Act, for all the pride I take in it and for all the applause that we should give it for its achievements, there's still more that could and should be done. And so he goes through these, what could be done in various of the features. For me, one of the most striking statements here is his statement on the top of page E6, left column, because it's an indication that he has shifted his political position from a position that polarized a lot of people during the battles over the Affordable Care Act, pro and con, during the 2009, early 2010 political seasons. He says some parts of the country have struggled with limited insurance and market competition for many years. Congress considered, and I supported, initially, not at the end, and I supported including a Medicare-like public plan, public programs, a public option. Public programs like Medicare often deliver care more cost-effectively by curtailing administrative overhead and securing better prices from providers using their group purchasing power as a negotiating tool. The public plan did not make it into the final legislation. It's certainly true. Now, based on experience with the ACA, I think Congress should revisit a public plan to compete alongside private insurers in areas of the country where competition is limited, et cetera, et cetera. Addition of a public plan in such areas would strengthen the marketplace approach, giving consumers more affordable options while also creating savings for the federal government. And he says also that we should adopt more of Medicare-like processes and negotiations. We should negotiate down drug prices. That's in the right-hand column, page B6. And I will repeat, he ends by what I said 4 years ago when the Supreme Court upheld the ACA. I am confident, as ever, that looking back 20 years from now, the nation will be better off because of having the courage to pass the law and persevere. At this point, as this progress with health care reform in the United States demonstrates, faith in responsibility, belief in opportunity, and ability to unite around the common values are what makes this nation great. What unintended irony. Faith in responsibility, belief in opportunity, and ability to unite around common values are what make this nation great. Had made this nation great at certain points in its history, and not so great at other points in its history. So I advise you, urge you to read President Obama's own assessment very carefully. I think it's judicious, it's well-informed, it's balanced, it's honest, and he looks back and says, well, maybe I should have pushed the public option. Politically, it didn't seem feasible. We would have gone off the rails. I was dealing with problems within the Democratic group because there were some so-called blue dog Democrats who were conservative politically and economically, who wouldn't want the public option. There was strong lobbying by the insurance industry and so on. But in retrospect, maybe it's not such a bad idea. Going beyond that, we have currently 17 senators and 121 members of the House of Representatives who have signed on to a measure that would go beyond the public option to create a Medicare for all, single-payer, Canadian-style, if you like, system of health care for the United States. 17 senators consist of one independent guy named Bernie Sanders, who introduced the legislation. It is now moving its way through. It's Senate Bill 1804, and 16 Democrats have signed on. Some with names you'll recognize, of course. One, sadly, Senator Elizabeth Warren, Senator, about to be former Senator Al Franken, and so on. Kirsten Gillibrand, and some others you might be interested in have joined that list. And that's a pretty remarkable development in American health and political life, that 16 senators have come out in public. What's even more striking to me is that there are 120 co-sponsors of what's called H.R. 676, which is the same single-payer measure in the House of Representatives. Never before have there been any more at the peak than about 70 or 80 members of Congress, of House of Representatives, to come out in public in favor of it. And what particularly pleases me, and SNAP may have something to do with it, certainly students associated with SNAP may have something to do with it. One of the people on the list under S's is Louise McIntosh Slaughter, Democrat, New York 25th District. Louise Slaughter deserves lots and lots of credit. She's our most famous local representative, a former public health nurse coming from Kentucky, still has her Kentucky accent, been here for many years, and has been at the forefront of all kinds of progressive legislation, women's health, women's rights, all kinds of things. She's been a terrific representative. But those of us who support single payer have been frustrated that, excuse me, just turn that off, sure. Sorry, should have taken care of that before. My apologies. Those of us who are supporters of single payer have been frustrated that Representative Congresswoman Slaughter has never supported until now single payer. And I've been part of delegations that have gone to lobby her on numerous occasions. Given a polite reception, she and her aides listen, and until recently, Louise or her aide has always said, well, I would support it if I had a sense that my constituents really wanted it. I don't sense that now, so though I'm interested in the idea, I'm open to it, until I feel a kind of upsurge from my constituency, I will not support it. Well, something has changed, because Congresswoman Louise Slaughter now supports it and joins 119 other members of Congress in supporting it. It means something. There are activities going on as well at the state level, and later I'll ask Alina to talk about that. Well, maybe this is the right time to talk about it. One of the things that's going on, I'll give just the bare outline of it. There is a measure that has been introduced by Assemblyman Richard Godfrey, who was an assemblyman from the New York City area. He's been in the New York State legislature for a very long time. He's been a very progressive political force. He has introduced many times, and yet again, a single-payer measure. That single-payer measure over the recent years, has successfully passed the assembly. There are two bodies in the state legislature, an assembly and a senate. There are more representatives in the assembly, and they are proportional to population and population density, so a lot of them are from the New York area. And as you might imagine, the assembly is pretty liberal, progressive, democratic. The Senate is like our U.S. Senate. It has a certain number of representatives from all areas. So an area that might have a very sparse population and be rural with conservative-leaning political tendencies will have its senators. So it's much harder to get the measure through the state Senate. It has gotten through the state assembly 2 or 3 times consecutively in legislative sessions by a 2-to-1 majority, by a significant majority. But it has failed to get the sufficient number of votes in the state Senate. When I was last involved with the lobbying activities and visited some local state senators, I visited Richard Funke's office, not with much success, to try to persuade him to support it. At that time, I think we were, those of us supported, we were 1 vote short of getting the needed majority in the Senate, which is closer than we've ever gotten. Now, Alina has been involved in various coalitions, Coalition for Health, Single Payer New York, SNAP. Can you bring us up to date and tell us anything else you'd like to in the next few minutes?
Sure. So I'm involved in both Campaign for New York Health and the student chapter of PNHB called SNAP, which is based in the medical center. So we're getting ready for the new legislative session in New York. So hopefully we can get a few more senators to endorse verbally the
What is the current tally? Is it 1 vote short?
Yeah, we have, well, last legislative session, we had endorsements from 31 senators, and you need 32 for the majority. We're also working...
Total how many?
What's that?
Out of a total of how many senators?
63, I believe.
So that would be just 1 past them.
I'm not sure, but yeah, we're 1 short. And we're also working on creating a body of supporters so that Governor Cuomo doesn't veto the bill if it passes the Senate, if we get to that point. And a few words about SNAP. This is just our first year as a formal chapter, and we support national single-payer legislation as well as New York Health Act. And although we don't think that the Affordable Care Act goes far enough in ensuring that healthcare is a human right and everybody has healthcare in this country, whenever there are attacks on the Affordable Care Act, we'll also mobilize and do phone banking, calls to senators, and things of that nature. If you would like to get on the listserv of the SNAP chapter, please stop by and I can get your email or email me so that we can get you on the listserv. We don't have formal membership, but you're always welcome to our events. We have educational events monthly. We're really hoping to invite Louis Slaughter actually next year. That would be fantastic. And we have little events once in a while as well. I was just talking to Angela the other day, and we're hoping to set up a desk at the activities fair that you guys have on River Campus beginning of next semester. And we're also planning a viewing of the documentary Fix It, which is a documentary about single-payer system and how it can work in the United States, also beginning of next semester. So stay tuned for that. Is there anything else that you would like me to mention?
I think that's very helpful.
Okay, great.
Just to point out, I think that SNAP is a very important indicator. There's a lot of energy in the medical school involving graduate students like Alina and medical students. I'm pleased to say that the current leader of SNAP chapter is now a second-year medical student, Abby Ritter, who was an undergraduate here. She's part of the RIMS program, She's an alumna of this course, so there's a connection and continuity. And there's also interest in the medical center, not only among the medical students and the graduate students, but there's a special, very elite MD, PhD program, where a very small number of students are very well funded and supported to pursue within a course usually of 8 or 9 years, both their MD and their PhD degrees. And they meet monthly, they have a dinner and a speaker. And I was the speaker this month and got a very warm reception when I presented to them. I thought they would be less enthusiastic, but apparently they are greatly enthusiastic. And one of the MD PhD students, Rohit, is in fact a very important leader of the campaign for New York, and very active, often canvassing in neighborhoods, going down to the public market, signing people up. He has an amazing energy for this commitment for single payer. So let me turn to my last handout of PH116 ever. This is a 20-pager, and let me walk you through it. So please have a copy in front of you. If you don't have one, there should be extras around. Page 1. This is meant to be a kind of sardonic view of what the Affordable Care Act actually looks like. Instead of being a smooth, carefully calibrated piece of legislation, it's a kind of jerry-rigged contraption, taking various pieces and slapping them together. If you may have run into, there was a famous cartoonist named Rube Goldberg who always drew extravagant contraptions of things that were sort of held together by bits of tape and chewing gum and ribbon and so on. They were obviously not the ideal engineering version of what could be done. And that's what this cartoonist is capturing here. Notice that you have indications of nautical and terrestrial and all kinds of whatever conveyance. So the ironic comment from one observer from Congress looking at the other, a reminder of what we can do when we all work together. Yes, that's what we can do when we all work together, settling on compromise. You put together a contraption like that representing the ACA. Imagine getting that baby up to warp speed. It would be pretty hard. So we turn to page 2, flip it over, and here's another view that I am very fond of the Affordable Care Act and its consequences. Take the American bloated, overpriced, excessive healthcare system and represent it conveniently as a huge, overswollen pig. And you could put lipstick on that pig, as Obama has done in supporting the Affordable Care Act, and you know the expression. You could put lipstick on a pig, but it's still a pig. So you can add a little cosmetics and tinker a little bit with the American healthcare system, and it's still that big, fat, bloated, overstuffed pig, which is another more organic way of looking at what the Affordable Care Act is. Not so much a billboard contraction, but an overswollen and very greedy pig. One of the fundamental issues is, I think, very cleverly defined on page 3 of the handout. In order to get compromise, to achieve political settlement, Obama had to deal in the insurance industry. He also had to make deals with Big Pharma and so on, with hospitals. One of the reasons that passed is because there have been so many compromises, but that leaves fundamental flaws and problems. So page 3 captures it well. Doc says to the patient, "Can you see the problem?" "Oh yeah, between you as the first party and me as the second party, we have an intrusive third party who's getting in the way." And that could represent managed care, it could represent the insurance industry in general. It represents the complexity that has been factored into the system. Page 4, I think, is a good way of looking at the noble knight, Sir Barack Obama, who has vanquished the coverage head of that three-headed dragon. Yes, coverage has improved, though he admits in the article very clearly that we're still going to have 30,000 people uninsured, and that number is not good enough. We have to do better. He tells you all that in the JAMA article. But he doesn't acknowledge quite so clearly, though there's some allusions to it, that that dragon still is extraordinarily threatening because the cost head and the quality head, which should be part of any real, massive, comprehensive health reform, have not been tamed at all. And so they still rear their heads and could do enormous damage. My view, shouldn't be a surprise by now, page 5, is that we should have opted, hopefully will eventually opt, for a single-payer system. Matt Worker, brilliant, brilliant cartoonist, a Pulitzer Prize-winning political cartoonist, captures the difference between what we have with the Affordable Care Act, which is that contraption supposedly delivering via intravenous line to the patient on the left, but what would be on the right, a single-payer healthcare system, would obviously be more efficient, more effective, and much less expensive. But what we have is not a single-payer system yet. Maybe we'll be getting there, either from the state level or from congressional level. We'll see. There are a lot of obstacles in the way. But I think that contrasts the ACA to single-payer. And part of the problem is, of course, our current political realities. Well, I really like cartoon on page 6. This is, I think, capturing very well a lot of the Republican dynamic. The repeal Obamacare shampoo. It's a little different from most instructions for shampoo. First you put on the shampoo, then you work yourself into lather. Here you work yourself into a lather first, and then you apply the shampoo, and then you repeat and repeat and repeat and repeat and repeat and repeat, as the Republicans in Congress have done. Never with any success, certainly while Obama was president, because, of course, he would veto any measure, even if it got both houses' support. Dynamic changed significantly with Trump's assumption of the presidency, and other things have begun to befall the Republicans, as on page 7. Even when they had the chance, Republican majorities, a very slim one in the Senate, and they lost key votes, McCain and Susan Collins and others, and that was what they needed. They were just so close. And now, if the election in Alabama stands and withstands what's most likely going to be Republican challenges and allegations of voting for and so on, we have a Democratic senator from Alabama replacing Jeff Sessions, our noble and beloved Attorney General, and Roy Moore, call him what you will, perhaps child molester, some have, did not win. It was a very close margin, 20,000 votes, and there'll be calls for recounts. Moore is going to have his campaign pay for it. He will, and so I don't think this is over yet. As Yogi Berra famously said, one of my great source of wisdom, it ain't over till it's over. So we'll see what happens. But the Republicans have been divided. They couldn't get the majority they needed in all the attempts to get the Affordable Care, their measure, the Republican repeal and replace plan, through, because they have been at odds with one another and lost key votes in a very slim majority. I love that image of the Republican elephants being against one another, and page 8 is another variant of it. There is the two-headed Republican elephant, with one head where the rump is supposed to be, or maybe, I would like this better, but it would probably be harder to draw, a two-rumped Republican elephant. In any case, the truth is, as indicated there, the Republicans were the ones who invented the individual mandate. It was their foundation, the Heritage Foundation, which came up with the idea during Clinton's health reform efforts. And they supported it until Obama supported it, and then they became against it. So we have, within the Republican Party, a strong pre-existing condition. It's hard for them to move forward. I enjoy cartoon on page 9. We have a contrast between, there's a consumer who is wearing that ill-fitting suit, call it Obamacare. It's not a neatly tailored suit. I don't like how this Obamacare thing fits. I'd like to try your plan on for size, he says to the representative of the Republicans. And they're the Republicans. That's what you'll get with a Republican plan. You'll be butt naked. You may not like the Obamacare suit, but at least you're protected from the elements and your embarrassment is covered over by clothing. What you'll get in the Republican plan is one horrific sellout. Interesting polling data, page 10. Polls conducted by the Kaiser Family Foundation regularly runs tracking polls. They asked those Trump voters what they thought of specific measures within the ACA, not telling them that they were within the ACA. Clever polling technique. If they said, here's a provision in the ACA, what do you think? Oh, we hate it, nah. So they didn't do that. They said, here's a provision. What do you think about that? And a remarkable thing happened. If you asked Trump voters, how many of you would support having young people stay on their parents' insurance until age 26? 83% of Trump voters said they like that idea. That's in the Affordable Care Act. What about you eliminate out-of-pocket costs for many preventive services? 75% of Trump voters said they like that. That's in the Affordable Care Act. Or how about, etc. So you can go down and see that a vast majority of the Trump voters polled like the Affordable. As long as you don't tell them that it's in the Affordable Care Act, it's all symbolic politics, until you get to certain kind of mandated things. So if you require employees of more than 50 employees to pay a fine if they don't offer health insurance, it dips under 50%, it's 49%. And of course, the bugaboo, the individual mandate, only 16% support that. But look at all those things above it, all of which are important parts of the Affordable Care Act, all of which have substantial Trump voter support. Page 11. More say President Trump's administration should make the ACA work than should make it fail. Question, what do you think should be the strategy? Of voters altogether, Democrat, Republican, Independent, 78%, as you see in the top bar, said, make it work. Sure, there are problems. President Obama is the first to admit there are problems. Make it work. 95% of Democrats say that. 80% of Independents say that. But surprisingly, 52% of Republicans say that. And even 51% of Trump supporters say that, which has been part of the political dynamic when people in certain states, Kentucky, Ohio, and so on, realize what's really going on, Senator Collins in Maine, with the Affordable Care Act. The Kaiser Family Foundation has been tracking public attitudes towards the ACA over many years, and there was an interesting uptick when the Republicans seemed most threatening to actually repeal the Affordable Care Act, and there was a spike up to more than 50%, so it dipped a little bit, and now it's unclear, but at least half of the population poll supports the Affordable Care Act. On page 13, Pew Research Center poll showed that 60% of Americans polled said they would like to make sure that the federal government guaranteed health care coverage. 60% of those polled. That's on page 13. If you look at page 14, it's very interesting. The American public is in so many ways so naive and so easily manipulated that if you phrase the question differently, if you say, well, do you support Medicare for all? Oh, yeah, sure, 63% support that. You add up the very positives and somewhat positives on the left side of that divide. If you call it guaranteed universal health insurance, oh, sure. You even have 56%, 57%, 29 and 28. If you call it single payer, well, it dips under 50, but still it has a pretty substantial support. If you call it socialized medicine, the very same thing, but you use the phrase socialized medicine, only 38% support it, and a majority oppose it. Maybe 38% impresses you. That's pretty significant when you call it socialized medicine. But how you phrase it, how you frame it, is an indication of what goes in our political environment. Just a few cartoons that I have fun with. There is our beloved and admired president, Donald Trump, saying, Obamacare's disaster. Everybody knows it. But it's outpolling you by at least 9%. It's probably increased. And then there was that moment in the spring when President Obama famously said, I didn't know health care was so complicated. Who knew? So the cartoonist says, who knew the sky was so blue? Who knew that rain was so wet? Who knew that fire was so hot? Great minds. Yes, sir. Okay. And then a very important part of political dynamics, he has said, Obamacare is exploding. It's collapsing. Well, in fact, what he's doing is sabotaging it, and a couple of clever cartoonists have caught the sabotage. There he is. Obamacare is going to explode, believe me, while he's reaching with his foot for the dynamite detonator, which is pretty well how it's happened. And there is another indication, cartoon 18. I told you it's collapsing, as he takes his buzzsaw to knock out the props of the Obamacare program, which has been what's happening, much reported, and very well documented. What's this all about? Well, as many have said, it's reverse Robin Hood, taking from the poor to give to the rich, money that will be taken out of the Affordable Care Act, that would wind up in $24 million uninsured by the Congressional Budget Office's neutral assessment, will go to tax cuts for the wealthy, as you can see in those screwy balances on page 19. And then my final image, putting it directly, what the Republican tax plan will do, it will obviously screw the middle class, can't be more graphic than that, and the GOP says to the screwed middle class, no use running to the doctor, I raised your taxes and took away your health care, so you are really royally screwed. All right. My final words are actually quoted words from two of my favorite analysts and commentators. Two Pauls who are very perceptive. One is Paul Starr, who is a sociologist, a health policy analyst, and historian at Princeton University. He was a colleague of William Reinhardt. And the other Paul I'll get to in a moment. He wrote a book published in 2011 called Remedy and Reaction, The Peculiar American Struggle Over Healthcare Reform. It's the best single-volume synthetic history and analysis of where we were as of the passage of the Affordable Care Act. He didn't know how it would come out. But he ends his book on this note, which I take to be a note of despair. He says, several of those involved in passing the Affordable Care Act told me that they saw it as a last chance for health care reform. After long careers fighting for universal health care, they doubted they would personally have an opportunity again. The Affordable Care Act already represented a significant scaling back of liberal ambitions, from Senator Kennedy's proposals in the 1970s to even what Clinton was calling for in the 1990s. In those debates, many Republicans had accepted the legitimacy of universal coverage as a national objective. That is no longer true. The earlier moral consensus has disappeared. In 2010, Congress finally overcame the usual drumbeat of fear by the opponents of reform with moderate legislation, that's the Affordable Care Act, that could help create a more just and efficient system. Repealing the law would not just mean denying insurance to more than 30 million people, it would be a confession of political helplessness in the face of a problem that has nagged at the national conscience for a century. The search for remedy would continue, but it would proceed under a shadow of uncertainty about whether Americans will ever be able to hold their fears in check and summon the elementary decency towards the sick that characterizes other democracies. Perhaps America will simply have to get used to the idea that although other countries can provide health care to all their people, the United States is too poor to afford it. The other Paul, of great wisdom and punch, is Paul Krugman, Krugman, who is an economist, policy analyst at Princeton University. It's a cluster of these very distinguished people at Princeton. Krugman often argues in economic terms, and if you want to take him on, you should be aware that Professor Krugman has received the Nobel Prize in economics. So you better be careful of your ground. Yes?
Oh, sorry, I'm just stretching.
Oh, okay.
Sorry.
He is a Nobel Prize winner in economics and a very, very strong critic of much Republican policy. He publishes columns in the New York Times, usually on Mondays and Fridays. And here are a couple of columns I'll just go through very quickly. One was published back in September 22nd this year. It's called Cruelty incompetence, and lies. One of the measures that was considered by Congress for the repeal of Obamacare was the Graham-Cassidy bill. And so he writes about Graham-Cassidy, the health bill the Senate may vote on next week is stunningly cruel. It is also incompetently drafted. The bill's sponsors clearly had no idea what they were doing when they put it together. Furthermore, their efforts to sell the bill involve obvious, blatant lies. Nevertheless, the bill could pass. And that says a lot about today's Republican Party. None of it good. The Affordable Care Act, which has reduced the percentage of Americans without health insurance to record low, created a three-legged stool: regulations that prevent insurers from discriminating against people with pre-existing conditions, a requirement that individuals have adequate insurance and thus pay into the system while healthy, and subsidies to help make that insurance affordable. For the lowest income families, insurance is provided directly by Medicaid. Graham-Cassidy, the Republican measure, saws off all three legs of that stool. Did Graham-Cassidy's sponsors know what they were doing when they were putting this bill together? Almost surely not, or they wouldn't have produced something that everyone, and I mean everyone, who knows anything about health care warns would cause chaos. It's not just progressives, like Paul Krugman, but the American Medical Association, the insurance industry, Blue Cross Blue Shield, have all warned that markets would be destabilized and millions would lose coverage. Republicans are trying to ram the bill through before the Congressional Budget Office has time to analyze it. An attempt that itself is a violation of all previous political norms and amounts to an admission that the bill can't bear scrutiny. But the CBO, the Congressional Budget Office, has analyzed other bills containing some of these provisions, and these previous analyses suggest that if this measure passed, the Graham-Cassidy measure, it would add more than 30 million people to the ranks of the uninsured. Lindsey Graham, Bill Cassidy, and the bill sponsors have responded to their critiques in the old-fashioned way with lies. I don't have time to read the other column. It's of the same temper, the same perspective, the same unpulled punches. As I suggest, if you want to take this man on, be aware you're taking on a Nobel laureate in economics. He knows what he's talking about, and he could probably outthink you several times around the book. In any case, I think these are the hard truths that we have to face, and we ignore them at our peril.